And the reality is that this crisis is really just beginning here in our state and across America. And people are looking for certainty, but the truth is we simply don't yet know how bad it's going to get, or how long it's going to last, or how successful these social distancing actions are going to be in flattening the curve. What we do know is that it is not going to be over in a matter of days or even weeks. And as I have been saying over and over again since day one, the number of cases is going to continue to rapidly and dramatically rise. It is critically important that every single person remains vigilant and continues doing their part by staying in place in their homes as much as possible so that we can break the back of this virus. Later today, I will be chairing another call of the National Governors Association. The nation's governors are working hard to speak with a unified voice and to drive further decisive action from our leaders in Washington. We have another call scheduled for tomorrow with the governors and with the White House, and we will continue to push for greater progress on the priorities that we submitted last week. We still need much more progress on ramping up the production and delivery of PPE, test kits, ventilators, and other necessary equipment.
So we think about all the different pieces of the puzzle and the limitations that we have there. So it's first it's beds, and then it's ICU beds, and then it's ventilators to support those beds. But those beds are worthless unless you have the healthcare workers, the respiratory therapists to monitor the vents, and the nurses and the physicians. And so you have to have the protective gear, the masks and the shields and the gowns to protect those healthcare employees. And something that most people don't think about, you also have to have daycare facilities to stay open or stand up ones on your own in order so that those parents, those healthcare workers have a place for their children to go. Otherwise, they're not going to show up at work. So we're working on all those pieces and trying to figure out what is that most limiting factor. And right now, it looks like as those issues around making it possible for healthcare workers to go to work, to go to the hospitals. And again, my hat goes off to all of them for the great work that they're doing.
Yeah.
But there are two main problems here. One, there's a shortage of testing supplies and tests and capacity to run those tests. And two, there's a shortage of personal protection equipment for those people administering the tests. And what the healthcare professionals are saying, because we have those kinds of shortages, that we need the personnel and the personal protection equipment used for people who are sick and who are in the hospital, and making sure that those healthcare providers are there. I think we definitely want to keep working on getting more testing supplies and getting more tests into the system. We need to do that because at some point, if we can test as many people as possible, we have a better snapshot of where we're going and what we need to do. But until this country can build up the supply chain for both personal protection equipment and testing that we need, we've got to concentrate it on the greatest need right now. And the important thing, the overall objective here, is to save lives.
I want Idahoans to know that every step of the way, we have been making sound decisions about Idaho's response to coronavirus based on the best advice of our public health experts. I would like to reiterate, we are doing everything at the appropriate time to prepare Idaho for further spread of coronavirus. We are all in this together, and we all must do our part.
Young people can and will be impacted by this virus. In fact, young people disproportionately are the ones testing positive in the state of California. 50% of the 2,102 individuals that have tested positive, 50% are between the age of 18 and 49. I'll repeat that. Half of those that have tested positive to date in the state of California are 18 to 49 years old. This disease impacts everybody. The question is the acuity and the hospitalization rate that, yes, does skew on the side of older populations. But with this tragic now death, it is a reminder to everybody to take this seriously. It's a health crisis. It needs to be met first and foremost head on as such. And that's why it is incumbent upon all Californians to continue to take our stay-at-home order seriously, to continue to do the kind of social distancing that common sense dictates.
I cannot stress enough that we need everyone to please stay at home or in their place of residence. These efforts are all aimed at social distancing, the single most effective way of controlling this deadly virus. As alien as it might be for us here in the Aloha State, we must avoid physical contact with friends and loved ones to protect all of us in this crisis.
The more we have people staying at home and avoiding contact with the virus, the sooner we're going to win this.